with us this Sunday, Dr. Ashish Shah. He's the Dean of the Brown University School of Public Health and CNN presidential historian Douglas Brinkley. Dr. Shah, I want to start with you. It's hard to know, listening to that from the doctors. They were not specific. They issued another statement late last night saying the president's doing better now that he is hospitalized. What is your assessment based on the information you have? And I know there's some missing. And to the point the president made in his video last night that he's feeling better and he hopes to be back soon, both on the job at the White House and on the campaign trail. Is that realistic?
Yeah. Good morning, John. Thanks for having me on. Very day yesterday. Lots of evasiveness, a complete lack of consistency, self-contradiction. It's hard to know how the president is doing. Obviously, we all hope he's doing well, but I think this is going to be a slow recovery. It's hard for me to see him bouncing straight back from this. Again, we all hope he does, but I think it's going to be difficult.
You think it's going to be difficult. Dan Balls, Doug Brinkley, put it this way in the Washington Post this morning. This episode, piled on top of everything else that has occurred this year, adds to the strain of a nation that never seems to have a minute to turn away from misery or controversy or both, never has a chance to collect its breath. Events, some of them once in a decade or once in a century occurrences, now play out all in unison. There is no respite. Put this moment into context for us if you can.
Well, I think it's the big moment of 2020. I mean, history's going to write about COVID-19, this extraordinary story. Donald Trump's fumbling out of the gate to get our country organized to attack the pandemic. Got a little bit of traction, but then started saying crazy things about what drugs to take and started not wearing masks, holding big rallies indoors, having one of the political leaders of his party, Herman Cain, die. And so here we are with the clock ticking towards November 3rd. The president of the United States, instead of campaigning or being able to fundraise in any normal way, is incapacitated. It's in Walter Reed Hospital. It is a major, big story. And we have to see, John, how this will play out on the rest of the campaign. Can there be future debates? I would just tell you, look, keep in mind, when we talk about the Kennedy-Johnson debates in 1960, the third debate there, they weren't in the same room, Kennedy and Nixon. JFK was in Manhattan, New York City, while Nixon was in Hollywood. You might have a situation where Donald Trump on October 15th has to do the debate in a different way, meaning telecommunication way from either the White House or Walter Reed. Otherwise, it gets scrubbed.
It's a remarkable, but given this year, I put nothing off the table given this year. Dr. Shah, we've talked about this repeatedly over the past several months, that behavior, frankly, that is just reckless and irresponsible from the president and people around him. I just want to go back in time a little bit. This is what the president of the United States, back when he was talking to Bob Woodward in all of those interviews about Bob Woodward's book, Rage, the president seemed to think that he somehow was different. Listen.
Well, you're risking getting it, of course, the way you move around and have those briefings and deal with people. Are you worried about that?
No, I'm not. I don't know why. I'm not.
Why?
I don't know. I'm just not.
You have that, Dr. Shah. Then you had at the debate on Tuesday night, there was a requirement that everybody in the hall was supposed to wear a mask. Members of the Trump family and other members of the Trump delegation came walking out in their masks. And when they sat down, they took them off. A Cleveland Clinic staffer tried to come and give them masks to tell them to put them on. They refused to put those masks on. The defiance of the president and the people around him in the past several months, what does that tell you?
Yeah, so I know that the president wasn't worried. I've been worried. Many of us have been worried. I have written and said as much that I've been very worried that the approach that the White House is taking to protecting the president, to protecting the first family, is inadequate, and that this is likely to happen. And here we are. I think there has been a cavalier attitude about all of this, that it's not a big deal, that they somehow, their testing program alone was going to keep everybody safe. We all knew it wasn't going to, and unfortunately, it turns out that science got this one right, and the White House could not defy the predictions of what we know about this virus.
And Doug, the lack of transparency about the specifics. What was the president's fever? How long, and for what need did the president need oxygen? Is that common, or is this unusual?
It's unusual for this modern era. You know, in the past, presidents would always try to conceal their illnesses, whether it was, Eisenhower with his heart attack or Woodrow Wilson with his stroke. But in this case, we really were being gaslit. I mean, with just two false different kinds of bits of information, letting everybody scramble. The whole world's leaning forward, trying to know what's going on now. We can't get any clear information. So it's a debacle. And, it's good that President Trump's able to tweet images of himself that are a bit reassuring, but I think full and utter transparency would be the friend of the president, and it certainly would be beneficial to the people of the United States and the world at this juncture.
Doug Brinkley, Dr. Shah, very much appreciate your insights this morning. Gentlemen, thank you. Up next for us, the national count of new coronavirus